Well, doctors around the country are warning about a shortage of several important drugs, including drugs that treat cancer. ABC's Andrew Fujii has the latest on what's at stake.
This morning, more doctors and lawmakers are sounding the alarm about drug shortages in the U.S., among them life-saving cancer medications, including chemo drugs.
These shortages can be life or death for kids, especially when it comes to the cancer drugs.
The FDA's drug shortage lists include those that treat lymphoma and leukemia.
We know how to treat cancer, but shortages force impossible choices. We have drugs that are life-saving and shortages that are life-threatening.
Testifying at a Senate hearing, experts blame the shortages in part on the low cost of generic drugs, with insurance companies often only paying for those cheaper generic versions.
A vial of sterile injectable medicine typically costs less than this cup of coffee that I bought downstairs this morning. So this reduces the incentive of manufacturers to invest in quality or in newer manufacturing facilities.
It's not just cancer drugs. Kimberly Yard's daughter has taken the stimulant Vyvanse for her ADHD for years, but her insurance company wants her to switch to Adderall, another drug in short supply.
Adderall's the one that started this whole shortage. So you want me to potentially not have consistent medication for my daughter? Instead, really? Why?
The government and drug makers blame each other for the shortage of ADHD medications. The DEA set limits on the ingredients needed to produce them because they're controlled substances. Drug makers say those limits are too strict.
The American Medical Association is now urging the U.S. government to consider manufacturing some of the drugs itself to alleviate some of the shortages. Andrea Fujii, ABC News, New York.